This is Brandon with the local guy.
Good to go.
Yeah. So, new unit, obviously, Carestream. So come over and show the screen. So there are a couple pieces that we always look for. One will be, there's this little gold rings down there. That means we're connected properly. And then for all captures with this unit, we're using Carestream imaging, both panels and 3Ds, just because it doesn't integrate with Eaglesoft. So in that case, we'll just launch. Very straightforward. You'll have to create the patient and you're going to take a shot. Just by hitting the new, fill out corresponding information, hit OK. And then once that information is filled out, it'll create them over here. For the sake of test, which I created, you just double click to launch. This will actually launch the actual imaging window. Up here, we're going to see two options. We're going to see pan, and we'll see 3D. So those are pretty pan, 3D, right? When we choose, so for example, we choose pan, it's going to do all of its settings over here, and it's going to launch an interface.
Yes.
In our interface here, it lets us do a few things. In program, it lets us pick if we want to select like different pieces. You can just do that by just clicking on it. You'll see that it kind of grays out when it's unselected or lights up when it is selected. Most cases you probably won't do anything with that because you have your sensors, but just a thing. Clicking on the gear here lets us swap between patients, both like child to very large, tall people, jaw type, even bite type. But most times you're just kind of using default. And then inside parameters, you'll never touch. Okay? Yes. Very straightforward. Over here, and you want to see this side. This is our kind of our positioning, okay? So this right here is obviously for pans. So they'll set their chin here, bite onto there, and then you'll want to make sure whenever you're doing pans, that you have the chin rest option right here, all the way up. If it's not, what'll happen is it's not going to let you actually capture. You're going to look over here, and this is in green. So you know it's not proper. And it's going to say right here, it'll say chin rest position wrong, right there. Chin supports position. So you'll just come back here and you'll just want to raise that for 2D. Now we're green, we can acquire the shot. If you want to view kind of how lasers are lining up, that's this button right here. This is just the positioning laser. Shows both laser forward and side. And the side one will shoot kind of here. That way you can get your mid and your side shots. Last but not least is our up and down of the unit. Yes. So up, down, very straightforward, right? Raise it until you're feeling comfortable. That's where the positioning is, and lower. Very straightforward. Yes. And then here's just our simple head clamps, right? Lower them, and that'll help them keep their head positioned. Then it's ready.
We're using
we come over here.
WebEx today.
And this is our hand switch right here, which can come off the wall. Do your best not to pull on this. This is the number one fault of these hand switches, is that this right here kind of sucks. So if you pull, you're going to eventually be calling me saying, hey, my hand switch doesn't work anymore. Don't do that. I always recommend doing something like this. And we just hold it. You'll watch the unit move. It's pretty quick and straightforward. And we can capture this whole thing if we want. Don't have to. It's like 10 seconds.
I've got the ID password when you're ready.
That's a short patient.
Oh, yeah, very much so.
Yep.
Okay, at that point we can let go. Patient can step out, and we're completed with the shot. Over here, you can just hit OK on the prompt. It will actually bring it up for us. Obviously, there's nothing there to capture. But that will preview the actual image of the panoramic shot, and therefore it's kind of ready. Once this is done, you can actually go open up on any of the stations by just launching imaging, and then double click. That patient image will be right here. And you can just double click that image, and it pulls right up to the image.
Password is 5 November 3.
Okay.
That's how to do pans. Very straightforward. 3Ds are pretty much exactly the same. They just use a different bite stick. So this one we'd actually be putting in here. Just slide that out. Slide that in until it's secure. It would bite onto here. And then in the 3D interface, very similar. It'll open up the interface, do the same thing. So the only super important pieces in here are the program and the chin rest. So in the program, you just click the box so you get there. This is actually letting you kind of select where you're capturing, right?
When I launch it,
So if you're wanting to kind of mainly focus like on this set of teeth, then you're going to kind of move the capture area to that, if that makes sense. By default, it kind of feeds here. It's like, oh, okay, this is our pretty normal shot. We're just getting this. The catch with the 9000 is that it's a much smaller field compared to a lot of others. So you're getting really kind of smaller shots. They're detailed, but they're small. So you'll want to play with this to get a feeling for it. Over here is the final piece. This is where our chin rest comes in play. There are two pieces here, lower and upper. So if we're going to do a shot that's on the lower part of the jaw on its teeth, then you want to make sure you lower this until the arrow is lined up with here. And now we're getting a lower shot of whatever area you're capturing. And then vice versa, if we're going for the upper, then we go even lower until we're now lined up with the arrow here into there. There. And that gets us now an upper shot of the jaw. Okay? And then, of course, when we're back to pan, we just raise it all the way back up. But that's pretty much the gist of it. Capture is pretty much the exact same. Hold the button, let it do its thing. Once it completes, it rotate, sets back, and then we're done. And then same premise. Now, the difference with the last piece is that 3Ds are not automatically going to show up. They take a second to build. So if you ever want to track that, you can just launch the task here. Just click on it once, and you'll actually see the task building. It'll actually say the patient's name and then percentage. And then once it completes, it'll actually feed right into here. And you'll see, I've taken test shots. And we'll just hit minimize when we want that. And then when you go and pull the patient up, you'll see a 3D object in this list, which you can just double click, and it will launch 3D imaging and let you play and manipulate the image.
Cool.
That's it.
Okay.